All right. There's my audience.
So don't pause it.
It's a grandma. Your day begins with a sneeze, then your nose fills with mucus, and you can only breathe through one nostril. A little tickle begins in your throat, and you begin to cough up colorful, thick phlegm. Oh yes, your body has been invaded with an upper respiratory infection, otherwise known as the common cold. So naturally you want to feel better, so you consider going to the doctor for a round of antibiotics. Working in a doctor's office, I see people come in for a variety of complaints. They have ear pain, sinus infection, or just a cold that seems to last for weeks. They all share one thing in common. They just want medication so they can feel better. Today I'm going to share with you the history, the types, and uses of antibiotics and how to use them effectively. So now let's start with a little history. Antibiotics have been used for the last 70 years to treat patients who have infectious diseases. According to the Centers for Disease Control and Prevention, otherwise known as the CDC, Alexander Fleming discovered the first antibiotic, penicillin, in 1928. Penicillin was discovered accidentally from a mold culture. After the first use of antibiotics, it transformed medical care and reduced illness from infectious diseases. The term antibiotic originally referred to natural compound produced by a fungus or another microorganism that kills bacteria that cause disease. Some antibiotics may be synthetic, which are not produced by microorganisms. So now let's go over the types of antibiotics. There are well over 100 antibiotics, but the majority come from only a few types of drugs. So here on this chart, these are the main classes of antibiotics. According to the Emergency Medicine Concepts in Clinical Practice by Barkin P. Rosen, you have penicillins, cephalosporins, macrolides, quinolones, sulfa, tetracyclines, and aminoglycosides. Most antibiotics have two names. I'm sorry. They have the brand name, which is created by the drug companies that manufacture the drug. So underlined in black are the brand names of antibiotics. So you have Caplex, Zithromax, Levaquin, and Bactrim, Samycin, and Toprax. And then you also have the generic name, which I underlined in red, which is amoxicillin, cephalexin, azithromycin, doxycycline, and gentamicin. So that's why you have the antibiotics that have two different names. So you may have heard them called by both of these names. Now, we will go over how to use antibiotics effectively. Antibiotics are powerful medicines, but they cannot cure everything. They kill bacteria that cause infections like strep throat, ear infections, urinary tract infections, and sinus infection. If an illness is caused by a virus, taking antibiotics are ineffective and they can do more harm than good. According to the American Medical Association, you should take medication exactly as directed. Take the exact amount and at the correct times. Take it for as long as prescribed, even if you're feeling better after a few days. Taking the full prescription is important to make sure you're getting rid of all the bacteria. If you cut your treatment short, bacteria may be left behind and can become resistant to antibiotics, making them ineffective and also could reinfect you with your disease. Do not save or reuse your antibiotics or use someone else's medication, because antibiotics are prescribed for a specific infection, so what is treating someone else's disease may not treat yours. I hope I've given you a better understanding of antibiotics. Antibiotics have greatly influenced modern medicine. According to William C. Schill, Jr., these are the most frequently prescribed medications. There are many types of antibiotics that work best based on the type of bacteria you may be infected with. It is important to be smart about using antibiotics and know that they help treat infections caused by bacteria, not viruses. So if you have the flu, an antibiotic is not going to be helpful to you. With the average adult catching a cold 2 to 4 times per year, and children up to 6 to 8 times, you may at some point see yourself at the doctor's office and leaving with the prescription for antibiotics. Use them wisely along with rest, fluids, and more rest so you can get back to being you. I'm done.